I'm Amy Knopf. I'm an associate professor here at the IU School of Nursing. I first got interested in research based on my experiences as a practitioner. I was a nurse in the oncology unit, surgical oncology floor, taking care of patients who were enrolled in clinical trials. And so I really got to see firsthand what it looks like to conduct research with human subjects. The other experience that really made me want to conduct my own research was my experience as a nurse in a primary care clinic for unstably housed adults, where I saw people coming in, being really sick or dying from the same illnesses, the same diseases over and over and over. So I really wanted to understand and work in the bigger picture. How do we prevent illness rather than how do we treat it and treat it well? So a lot of my work now is sort of situated at the intersection of the social determinants of health and biomedical ethics. How do we engage people in research in an ethical way and make sure that we're reaching people who often are not engaged in research? Right now, I'm working on several projects. So I am the chair of the bioethics committee of the NICHD's, the NIH Adolescent Medicine Trials Network for HIV Prevention. A lot of my work in that project is focused on developing consent forms, ensuring that teenagers are able to understand what they might be signing up for, and also providing guidance to investigators and clinical staff around ethical concerns of engaging adolescents in HIV prevention research. I am also finishing a study that was funded by the Patient-Centered Outcomes Research Institute that uses public deliberation to try to get together multiple groups of people with different opinions about when minors should be able to consent to medical research, and trying to get them to arrive at a conclusion that everybody can agree is justifiable or ethical. I really try to follow the principle of nothing about us without us, and engaging people who've often been left out of research in my work. And for me, being able to do that successfully has been really important. I think what makes the IU School of Nursing unique relative to other places that I've been is there is just such a strong collaboration between the School of Nursing and other schools across the institution. And I think that speaks really highly of our investigators and of the environment at IU. I think that we're very driven to excellence, driven to results, driven to achieve. Once we've accomplished something, we don't just sort of sit down and say, okay, great, I'm done. We keep working, we keep striving. And I think that we really just never let up.